because the World Health Organization boss has announced that 7 billion euros has been committed by world leaders to develop a vaccine for the COVID-19 pandemic. The support came through the COVID-19 Global Response International Pledging event coordinated by the European Commission. Details in this report.
Some 7.4 billion euros has been pledged for research and development for vaccines, diagnostics and therapeutics, announced Director General of the World Health Organization, Tedros Ghebreyesus. This development came as leaders from 40 countries all over the world came together to support the ACT Accelerator through the COVID-19 Global Response International Pledging Day, hosted by the European Commission on Monday.
This was a powerful and inspiring demonstration of global solidarity. Recent advances in science are enabling the world to move at incredible speed to develop these tools. But the true measure of success will not only be how fast we can develop safe and effective tools, it will be how equally we can distribute them.
In the wake of easing lockdown caused by the COVID-19 pandemic in several hard-hit countries, Michael Ryan, Executive Director of WHO's Health Emergencies Program, said countries have to think twice about the risk posed by the COVID-19.
Countries open up their economies and open up their societies, and as they look at different gatherings, be they religious or social gatherings that occur, they've got to calibrate the risks associated with those gatherings, which are based on how much virus is circulating in the area, so what is the absolute risk of exposure, and then what are the increased risks of being exposed in an environment where there are a number of people who cannot maintain physical distance or potentially maintain hygiene or other measures.
Dr. Ryan also sought to reassure the public regarding contact tracing methodology.
Contact tracing and case finding is not about surveillance or interrupting people's lives. It's about trying to identify those individuals who are sick and in trying to ensure that those sick individuals are tested and cared for, and that anyone who is in contact with them is monitored and then subsequently tested and cared for if needed. In doing that, we reduce their role in spreading the disease to others.
Dr. Maria Van Kerkhove, Technical Lead COVID-19 of the WHO's Health Emergencies Program, said what needed to be understood was the animal source of the coronavirus. He explained that the WHO did not receive any data or specific evidence from the US government relating to the purported origin of the virus. The source of the virus, he said, remains speculative, and that the WHO will be very willing to receive any information that reports to the origin of the virus. Reporting for iAfrica News, I am Absegay.